Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Jay Nakashima. He's president at eHealth Exchange. Welcome, Jay.
Hey, thanks for having me.
Yeah, excited to dive into a lot of the things you guys are doing in the world of interoperability. You know, there's TEFCA, QHINs, there's so much going on right now. But for those that aren't as familiar with eHealth Exchange, can you tell us a little bit about the origin story of eHealth Exchange and maybe share some of the details of the evolution of your organization?
Yeah. So eHealth Exchange is a nonprofit corporation founded by, in reality, the federal government back in 2006, and we operate for the public good. And we facilitate the exchange of detailed medical records electronically all across the U.S. And we facilitate the exchange of about 25 billion records.
Wow.
So it's a really high volume. And I think in particular for a nonprofit health tech company, it's rather astounding. But we started out as a U.S. Department Health and Human Services initiative. And once the U.S. government as a project was able to prove or demonstrate that medical records could be moved around electronically, especially between the VA and the U.S. Department of Defense and some private hospital systems, as I'm told, the U.S. government was ready to turn this off. And I think all the players involved, the VA, the DOD.
Like, we did all this work, what are you doing?
I think they cried bloody murder. And so they moved eHealth Exchange, it was called the National Health Information Network, over to the private sector as a nonprofit. And we kept going, and we flourished.
Interesting. I mean, it is interesting to think that, you know, they did all this work to prove that it worked and then just shut it down. So I think it's awesome that you continue. And I mean, you do over 1 billion transactions a month, I think you said, right? It's crazy.
Yeah, really over 2 billion a month.
2
correct.
billion.
Yeah.
Wow, it's amazing how quickly it's evolved. I think the other thing that is really popular, and here at the eHealth Exchange annual event, we had a lot of discussion about the disputes over patient privacy, interpretation on policy and how you understand that, even allegations of inappropriate requests for data that really has hit the industry, across the board, I think, as we discuss it. How do you approach building trust with stakeholders in such a complex and quite frankly, sensitive ecosystem?
Yeah, great question. So fortunately and or selfishly, the dispute that you mentioned that's really rocked our little sector of healthcare IT did not involve eHealth Exchange. But I feel as though it was almost as painful for us just to watch it. And it's in retrospect fairly inevitable now that we have these digital health organizations who are requesting electronic medical records. But within eHealth Exchange, we have deep roots with the federal agencies. We've been around for 18 years. And I believe that we tend to be more conservative into who we allow into our network.
Okay.
And now above and beyond that, we have really tight policies and procedures about who we can permit into our network, when they can request data, and then we do not use data for secondary purposes. So we focus on trust.
Yeah. Well, I mean, to your point, and it was kind of highlighted by some of the speakers, is like, in fact, it's almost amazing that it didn't happen sooner. We've done a decade with billions and billions of transactions, and the fact that a dispute didn't happen for so long is actually probably a credit to how much of a trusted framework you and others have created.
Yeah, I do think that that the analytics or the process of reviewing the transactions has really increased over the past year and a half.
Interesting.
So at eHealth Exchange, we've been we've allowed our participants to review all the transactions that go through our system, and they receive since day one.
Okay.
But I don't believe that capability has always existed with all the other networks. And I'm not sure that it exists at all with some other networks. So that's something that they're, if true, that they're rapidly building.
So tell us, what is eHealth Exchange focusing on in 2025, as you continue to push forward and, improve the data sharing that's happening?
Yeah. So a number of things, but I won't rattle them all off. But of course, we're continuing in our pursuit of TEFCA, and that's the new government-sponsored trust framework. But above and beyond that, we're really focusing on increasing our exchange with public health agencies. So we already have connectivity with public health agencies all over the US, so in all 50 states, and all electronic case report notifications about notifiable conditions like, hey, Jay has hepatitis B, or hey, Jay has monkeypox or orthopox, whatever.
Sure.
Those all go through eHealth Exchange. But one of the public health things we're trying to further roll out are case investigations. And so what that means is that when a public health agency, be it the Tennessee Department of Health or the Nashville Department of Health or the Nashville County Department of Health, receives a notification that, hey, patient J has COVID or hepatitis B or whatever, they are inevitably going to need additional information. And instead of forcing them to warm up their fax machines, instead of them having to make telephone calls to say, hey, I need Jay's race and ethnicity, or I need Jay's phone number so I can call him, or I need some data element like Jay's blood pressure or lab result. They're able to electronically request that additional detail in a self-service environment and get it back. Now, if you were a clinician at a chairside, bedside, tableside, and you were trying to decide what kind of treatment you were going to provide, that'd be a slam dunk. You could get that. But because of some idiosyncrasies with HIPAA and the way EHR vendors have set up their EHRs, the response rate for those case investigations is currently 0.
Wow.
So we're working with the industry and with regulators to try to make it so that our public health agencies can be more effective and get the data they need to protect Americans' health.
Interesting. I mean, I think that's a great example of working with the government. Are there any other examples that how eHealth Exchange works with the federal agencies, states, other private organizations to improve data sharing?
Yeah, so we work with a number of federal agencies who, number one, many of whom were involved in founding us 18 years ago, as well as additional federal agencies, most of whom are participants or members of eHealth Exchange.
Okay.
But one example is the CDC. We work very, very closely with CDC, FDA, VA, Indian Health Service, Social Security Administration, CMS. We work with a lot of federal agencies to try to automate and improve data exchange.
Yeah, Indian Health Services was the first on the queue, right?
Yeah, and it's so impressive. Of all the federal agencies, it's really heartwarming to hear that that Indian Health Services is the first who's able to take advantage of this government-sponsored trust network and hopefully improve the health of their population.
Yeah, it's awesome that they were able to be that forward-thinking, and it's great that they're getting that kind of service. Let's talk about FHIR. What do you see as the role of FHIR and maybe other emerging standards? And are we facing barriers to, due to unproven specifications? Or kind of talk to us about FHIR and how you're using it.
Yeah, so we are, we're going wild on FHIR, and FHIR is an API. So think about, when I talk about an API, think about the apps on your mobile phone. They're powered or connected via APIs. But we started with FHIR in 2017. And now we're really leveraging it, number one, for public health exchange. So the FDA is really ahead of the pack, and they're saying, hey, we're new to the exchange of electronic medical records, and we're only going to exchange using FHIR APIs,
Wow.
the new way.
Okay.
But we're also branching out and encouraging the exchange among our providers and payers. And that's optional exchange for the providers. But it really streamlines what they're already doing. And when I say what they're already doing, I'm saying, hey, providers, 6 days a week are sharing data with payers via spreadsheets, via faxes for sure, or via old-fashioned HL7 version 2 messages. And so our rollout of FHIR is a much more streamlined and scalable way for data exchange.
Yeah, you'll appreciate it. I was talking with one of the interoperability experts here, and they said eHealth Exchange is so far ahead in what they're doing with FHIR compared to everyone else. So
yeah,
your work is being seen.
That's wonderful to hear. And again, it's just not something I would expect of a nonprofit. So that's nice to hear.
Yeah, that's awesome. Well, we talked about Indian Health Services recently went live on TEFCA, selecting eHealth Exchange as its designated QHIN. Do you think the momentum of TEFCA will continue in 2025?
Yeah, my crystal ball is foggy, but yeah, I do think it will. I do think it will continue. It's a voluntary government program. They provide those involved precisely $0, and yet it's all this little sector of health IT has been talking about for a couple of years. So, and Mickey Tripathi from HHS, ASTP, ONC, sorry for the acronyms, has really been instrumental in getting that rolling. So I do think it's going to continue. Congress and the president in 2016 called for it, required it via the 21st Century Cures Act. And so I do think the velocity will continue.
Yeah. No, I just talked to someone and I said, oh, will it continue? Like, well, it's in legislation. So it's going to continue in some form or fashion.
Yeah, well said.
Hopefully the next coordinator that, comes after Mickey will push it forward as much as he did.
That's right.
Yeah. Well, Jay, this was a lot of fun. I love hearing about what eHealth Exchange is doing. I think a lot of people don't realize how many billions of transactions are being shared every day with public health, with provider organizations. So appreciate all the work you and your team are doing, and appreciate you sharing how you approach it. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Jay.
Yeah, thanks for having me.